Okay, guys, there's been some questions on how the global evaluation, CROs, and all that kind of stuff work out. So I'm going to try to do a quick tutorial here and see if this will help you. So first things first is I have shared this folder you can see here with everybody. It's called CROs 2015. So make sure you check your Google Drive and you should see this folder that's shared with everybody. In this folder, you're going to have all of the CROs, which are your clinical rotation objectives you need for your semester. So what do you do? Well, let's say Gabby, for instance, because she's actually who brought this to my attention. So Gabby's at Northern Guilford High School. So she has a high school rotation. She is a male. She is lower extremity. And she has equipment intensive. So that's what she looks like. She is high school, male, lower extremity, equipment intensive. A lot of you are either going to be high school or college, obviously, male or female, lower or upper extremity, and those who are working football are going to be equipment intensive. If you're not working football, if you're working soccer, volleyball, or something else, you will not be equipment intensive. But everybody working football, regardless of the level, will have an equipment intensive CRO. So what you do is you simply go to the folder right here, and let's pick the first one, high school. So we come down here and we click on high school CROs. Now this is what Gabby is going to be responsible for during her time at Northern Guilford High School for this rotation. I'm going to make it a little bigger so we can see a little bit easier. So the far left column is the objective. This is based on the competencies, okay? So this is what the big national body says you have to know in order to be in this program. So these are what you have to. So these are the objectives. The first objective is to work on communication, administrative. Second one is therapeutic interventions. Third one is high school population, physicians, etc. The learning activity, and I'm sorry that the formatting didn't work, but the learning activity is what you actually do. So you participate in daily administrative duties, you apply commonly used modalities, you discuss for preceptor, etc. This is what the outcome is. So this is what I hope you do after you participate in daily administrative duties. The outcome is that you effectively can then manage daily administrative duties. So you see the progress. And this is how it's being assessed. Now, typically, this is going to be assessed by your preceptor. Some things I will assess, and I'll show you. So if you take the first one right here, you can see this is being assessed by the Global Administrative Evaluation Form. So that means your preceptor goes online and clicks Global Administration Evaluation Form. This is already available to them in drop-downs. And then they either click Injury Tracking, Parental Consent, or Patient Records. So what your whole idea with this CRO, which is broken up into 3 parts, is that you have to be able to participate and competently show that you know how to do injury tracking, that you know how to obtain parental consent, and that you know how to update patient records. Mess that up. Now, this could be different in your situations. In one high school, you might have a different patient record system than another. The idea is that you know what your particular site does and that you're competent in what they do. All right? So what you do is when you complete one of these, you ask your preceptor, would you mind evaluating me on this CRO? Okay, and then go online and they either give you a 1 or 2 or 3 or somewhere wherever they want to on that Likert scale. Remember, 2 is your passing. Okay, so that's the first thing. So this is for your administrative, and then you have all of your modalities, and as you learn these modalities in class, you will be able to be assessed on them in your clinical setting. You cannot be assessed in the clinical setting until you've completed it in the lab section. So you have cryotherapy, thermo, stim, ultrasound, etc. You move down here, and now these are discussions. Okay, so your preceptor doesn't need to do anything. This is on you. You have a discussion with your preceptor on these 3 topics. Working with the high school population, working with physicians in the high school population, and the high school association rules and regulations. And having these discussions, then all you do is in your bi-weekly report, you document and you date when you had that discussion. Okay? This last part is the end of rotation analysis. So this is due at the end of your rotation. So don't worry about this last part. Okay? So what you have to do for the high school setting, your preceptor has a bunch of global evaluations. So as you perform these, ask them to evaluate you, and then you have some discussions. So that's what Gabby has to do for her high school. Now, we go back here. She needs male. So let's click back here. Where's our male? This is what she needs to do for the male population. She has to document a discussion. So she has to discuss with her preceptors eating disorders. Okay? Second thing, she has to do some discussions and a presentation. So the first thing she does is she discusses with her preceptor these 4 conditions: testicular cancer, oral cancer, and smokeless tobacco. Male supplement use. What I mean by that are what are the typical supplements males use? If you have a female rotation, what are the typical supplements a female uses? And then general injuries. So discuss those 4 topics with your preceptor. Then you have to go and design a presentation. It says right here, see the patient population rubric. So what we do is we go back, and I have shared this folder with you also, I believe. Double checking. Yes, you have been shared with it. So you click rubrics. You click patient population presentation rubric. And what you do is you follow this rubric and you do a presentation. Again, here are the 4 males. Here are the 4 females. Here's step by step on how you develop your presentation. So this rubric right here is provided for you. So you know exactly what you have to do for these 4 presentations. Okay? You have to do 4 presentations, your rotation. And if you scroll down, then you have an at-risk rubric. Again, we can go here. I don't have it up yet, but the at-risk rubric. And then you come back. Oops, I'm clicking all over the place. A couple more discussions. So when you look at these clinical rotation objectives, you want to see 1, does it require a global evaluation from your preceptor? 2, does it require a discussion with your preceptor that you have to document on your biweekly? 3, does it include some sort of submission that goes directly to me for your Google Drive? So you simply upload it to your clinical folder. That's the 3rd type. And then 4th is any combination of that where you have to do a discussion and a submission. Once you figure out how I'm assessing it, and once you figure out what the rotation objective is, it should become much easier. So my advice is let's go through and figure out all of the objectives that you need. And then as you start developing and as the rotation goes, you're going to look for them. So you need to be a little bit vigilant because you want these to happen in real time. Okay, and that's especially important if we go to Gabby's 3rd one, which is lower extremity. So I'm going to go right here to CROs, lower extremity. Now, you won't be able to be assessed on any of these until we do it in class first. But you can see, here are her objectives, what she needs to do. Here is how we're assessing this. So this is a discussion and a global evaluation. Global evaluation. Global evaluation for each of the 5 different body parts of the lower extremity. Moving down here, we have fabrication, we have standard equipment, and we have taping for lower extremity things. If you're upper extremity, these are going to be different. So instead of a closed basket weave ankle, you'll have a shoulder spike. Okay, they are different depending if you're male, female, upper, lower, etc. So again, looking at what you have to do with the objectives, looking at how they're assessed, and seeing if there's any sort of submission that requires a rubric. And I'm updating all these rubrics, and I will get them all, and they will always be in these folders. So a rubrics folder and a CRO folder. All right, so we have her setting, high school. We have her population, male. We have her exposure, which is, and we'll move over here, lower extremity. And the last one is equipment. So if you come back here, I hope I have, there's my equipment. And because she's working in equipment intensive sport, here's what she has to do for equipment intensive. And that is being able to select and fit the following protective equipment intensive things completed with a global evaluation. Okay? Now, this may seem a lot because Gabby has 1, 2, 3, 4 separate rotation objectives complete in only 15 weeks. But these things don't occur in isolation. Don't think of them as occurring in isolation. So let's look at the extremity, and here's what I mean by that. if you have someone who has an acute ankle sprain, okay, let's say they just sprained their ankle, that is a multitude of CROs completed with one patient, okay? It could be an acute injury right there. So you could have an acute injury rotation objective. It's going to be an ankle. So you do the lower leg ankle evaluation. It could require a taping technique. So maybe you have to do a closed basket weave. Maybe you have to do a fabrication. If you come back to the high school, maybe it's going to require ice and stim. So you can do cryotherapy and then e-stim. And maybe you have to do an injury tracking to place it there. In other words, none of these things happen in isolation. So even one injury, you can accomplish 4, 5, 6 rotation objectives. And that's the idea, is that you see how all of these things intersect and come together and go apart. Okay? So don't think of it as you need one acute injury, one ankle. No, no, no. You need to look for these particular injuries, opportunities, etc., and then it can occur in 1, 2, 3, 4 patients. Now, your preceptor will need to complete separate global evaluations for each of those so we can document it, but can all occur through one patient or 2 patients or something like that. Okay? Now, we want as many of these to be in real time as possible. So don't go thinking you're going to knock all these out and simulate them. That's not the intent of the program. We want you to get used to doing these on real patients, real injuries in real time. So that means you have to be a little bit patient, okay? Use the first couple of weeks to sort of feel yourself out, etc. Now, I'm assuming most of you know how to tape. So these lower extremity taping applications, you could do these right off the bat because you've already been assessed and tested in the classroom on them. So don't be afraid when the seat rotations start to get some of these taping and wrapping CROs completed. Okay? Now going all the way back, once you get all these done, once you feel comfortable with them and you've been assessed on them, etc., what you do then is you look at your oops, sorry, I'm in the wrong one. It's my bad. Where's your biweekly? There's your biweekly form. So what you'll simply do is list any of the discussions that you completed, any of the submissions which you're going to electronically submit to me, and then you hand in this form as a hard copy to me every 2 weeks. As a point of clarification, when I said in that email about the WVGT, I considered the first biweekly the one after your rotation starts. So the one in the last week of August, or I think it might be due September 1st, okay? That's your first biweekly. You have a preseason biweekly, that doesn't count. Your first biweekly is 2 weeks after the start of classes. Now, I know this is a lot of information, so you might want to watch this video more than once, but the idea is you take your setting, population, exposure, you find your rotation objectives, and you figure out what you need to do for those settings. You can't be assessed on any of them until we do it in the classroom first, so there will be a little bit of a delay time. That's okay. So look for real time, look for real injuries, and if you have any questions, we're going to talk about it throughout the year, so I'm not just going to send you out to the woods. I hope this video helped, and I will see you guys out there on the fields. Bye.